Today we'll be demonstrating a prototypical patient with patellofemoral pain syndrome. We'll show how that patient may present and also demonstrate an appropriate intervention. Our example patient today is 17-year-old high school senior Ashley. Hi Ashley, what brings you to the clinic today? I haven't seen you since last spring.
My knees and both of my knees are bothering me again.
Oh, I'm sorry to hear that. Has anything in your life changed recently?
The track season started up again, and I'm training for the 800 meter and the triple jump.
Okay. Did you have any pain before the track season started?
No, all winter I kind of didn't train at all, so I've just been relaxing.
Okay. Can you tell me a little bit more about your knee pain? How long has it been going on for?
It started about the 4th week into my season, and it hurts when I'm running and doing jumping activities.
Is there anything you can do to make the pain go away?
When I ice it and I rest at home after my track practice.
Okay. Do your knees ever hurt outside of athletics?
Yeah, I've been noticing when I sit in the car for a while or when I sit down, and especially when I go down the stairs to my bedroom after practice, they hurt really bad.
Okay. Can you describe the pain for me at all?
It's really achy and kind of everywhere, but more specifically, I feel like I can touch it underneath my kneecap.
Okay. So after clearing all the appropriate red flag questions, we move into observation. So can you go ahead and stand up for me, Ashley? Just try to stand normally for me. All right, so with this patient, we're observing some foot pronation. We're seeing the patellas facing each other medially, which would be indicative of femoral internal rotation. Based on this stance, we can assume that there's some weak hip external rotators and abductors, and that could be contributing to the pain. This patient would present as our knock-kneed sign. Okay, so I'm going to go ahead and pass you off to my colleague Mia. She's going to run you through a step-down exercise, okay?
Hi Ashley, how are you? Good, how are you? Good. So today what we're going to do is a step down. It's called an eccentric step down. And we're just going to look to see where your knee is facing and how your foot is. And I can show you first. So I want you to step down on your left leg. So you're going to hold on here and just step onto here. All right. So you'll notice that she's a bit shaky and she'll have some internal and external rotation when she's going down, and then her foot's pronating a little bit. So I want you to be a little bit more controlled and try to make sure your knee is just facing forward when you're doing that step down. It's a little bit better. And we would want to work on this and try to do a couple sets each time that we visit with her.